Hello and welcome, you guys. This is Dr. Jones. Welcome to tonight's webinar on dog food and nutrition. And in particular, we're also discussing my new supplement, Ultimate K9 Advanced Health Formula. I'm just going to give everybody a chance to get on before we get going with today's presentation. And I'm hoping to leave a little bit of time for, some of the Q&A at the end, although I have added even more questions. So, wow. Hi, guys. Hello and welcome. I think what happened is I tried to log in early, and I think I didn't pick the webinar, so I'm just going to type in hello and welcome. Hello and welcome. And I'm also going to put in ahead of time. Let's see what I think I made this hello and welcome. I'm going to put in my email as well. So that's going to be the email in particular relating to questions around the webinar presentation and also about the supplement. The email is going to be Dr. Andrew. So my email for this presentation will be drandrew@thedogsupplement.com. All right. So I'm thinking it's good. I'm just going to check here. Hello. But okay, but I see everybody's started. They're saying. But you guys can't hear me?
I don't see anything. Even the client side of reconnecting, it says live stream offline.
Oh, fuck.
No sound. Nothing happened.
You know what it is? It's probably because I logged in early and then I hit in. No. I didn't start. Okay, so no one, you can't hear it now or see it?
I popped out. Oh, there you are. You're on. I can hear you now.
Yeah, awesome. Okay, thanks, bye. All right, guys. Sorry for the little bit delay there. We're just trying to make sure everything is working before we get going, and I love it. Okay, you guys have sound now. Yay. A bit of an internet lag there. Well, hello and welcome. Thanks for being on today's presentation. That's me picture there. I'm Dr. Jones, and that's my last dog, Lewis. I'm going to get going right away. We're going to be talking about some of the problems with commercial dog food, how you can best help your dog, what to feed, natural remedies. Be discussing a little bit about my new supplement for dogs, Ultimate K9 Advanced Health Formula. I'm going to try to go in and out with glasses. So there it is, the presentation for the webinar again. I'm going to try to leave a little bit of time at the end for some Q&A. I'm just going to make sure you guys can see me too. Yeah, I think I'm on there too. So as well as seeing the webinar, you can also see me. We're going to cover a whole bunch of information. So just do whatever you can to sort of focus, take notes, shut off all your distractions, email reminders, phone, etc. But also remember, you're going to get a copy of the presentation, so as well as a recording of the video, as well as the PowerPoint slides. Who am I? For those of you who don't know me, I was born and raised in a farm. I always wanted to be a veterinarian, and I spent countless hours with our animals. That's our whole family pictured there. I'm on your far left with those styling shorts with our cat Beauty. Michael, who's on the other half of the business, is on the far right with that styling shirt and haircut. I graduated from the University of Saskatchewan in 1992 with my DVM. I practiced for 17 years, owning the Nelson Animal Hospital here in Nelson, BC. I wrote my first natural care digital book, Dr. Jones's Book of Home Remedies for Dogs and Cats, in April 2004. Since that time, I've published hundreds of articles, reports, numbers, over 300 videos, 2 home study courses, and a live seminar. I was featured on ABC's News Show 2020. So after the presentation, you can Google Vet 2020 and up will come. And interestingly, at the time, they said that was their most commented on sort of segment to date. It was seen as some people controversial, me just sort of revealing some of the things that go on in a normal day-to-day veterinary practice, some of the business decisions and how that relates to pets and pet care. And a number of people took big issue with it. Just a second, I'm just going to open my window here because it's smoking hot here. It's like 31 or something Celsius, with I'm sure that equates to like the high 80s Fahrenheit. So I'm hoping to get some airflow too. I released my first hardcover book, Veterinary Secrets, on Amazon in 2014. It's hard to believe, almost 4 years ago. Super happy to see it going to become a #1 bestseller. That happened within the first week. If you're a person who bought a copy, that's awesome. Thank you. Currently, I have the largest natural pet health and wellness channel on YouTube, now with over 120,000 subscribers. So once again, after the presentation, you can Google Dr. Andrew Jones YouTube or Veterinary Secrets YouTube, and up I'll come. And I'd love it if you would subscribe if you haven't done so yet. In part, this is memory to my last dog, Lewis. He died a little over a year ago. Here he is, pictured there. He was this awesome sort of black lab cross. There's a big group of puppies that came into the shelter when I was practicing, and I mean, it's kind of hard to resist. It wasn't necessarily the best time because my daughter was pictured there. She was born at the exact same time as Lewis would have been born. So, you know, I had a 2-month-old daughter and a 2-month-old puppy, but he was an awesome dog. And here's our new dog, Tula, who is also a great little dog. We recently acquired her from our neighbors who have since moved away. She's a little sort of standard poodle, Kootenai terrier mix cross of everything. She's got a really neat personality. Bit about the health of our dogs today, which is the whole point of the presentation. And really, they should be living longer. We shouldn't be hearing about, you know, these middle-aged dogs developing cancer. And if anything, that appears to be the opposite. I mean, why do we have these, you know, animals, our dogs, with relatively short lifespans? We think we're doing everything correctly, and they're getting, you know, some of these serious diseases, and it seems like at younger and younger ages. The golden retrievers, which are just awesome dogs. You know, so why is it? They have short lifespans, for instance, really high cancer rates. You know, in my opinion, and I think in many people's thoughts, you know, one of the big keys to having a healthy dog is, you know, the diet, like what's going into your dog's mouth. Are they all wholesome ingredients? Unfortunately, the pet food industry is just an extension of the human food and agriculture industries. So just think about it. They're producing food, like cows going to a feedlot, like, oh, we're going to feed all the expensive stuff to people. They're going to give us the most profit. Great, let's just streamline this. Let's see how we can sell the rest of it, and let's turn it into pet food, for instance. You know, things considered unfit for human consumption. Waste, intestines, and in some cases, yes, even diseased and cancerous animal parts. And this comes from Susan Dixon's site, The Truth About Pet Food, and, you know, where she actually met with the FDA and asked them directly, will the agency continue to ignore the law allowing illegal, diseased, dead animals to become pet food ingredients after the certain risk discussed, such as they were discussing a certain type of bacterial toxin that could be produced called endotoxins? And the agency said, we're going to allow these animals that have died other than by slaughter that are further processed in pet food. Just hopefully people will not use that protein in a raw pet food diet, meaning they're in there, right, in some of those foods. So what can you do to at least avoid those ingredients, disease, cancerous animal parts, animals potentially, you know, that have died other than by, you know, they've been healthy by slaughter? Would be avoiding chicken byproducts, chicken byproduct meal, turkey byproducts, turkey byproduct meal, meat meal, beef meal, lamb meal, venison meal, meat and bone meal, animal fat, and animal digest. Some of the toxins found in pet food. Well, some of the suspect carcinogens include chemical preservatives, you know, such as our own food. You know, things such as ethoxyquin, BHA, BHT, propylene glycol, sodium nitrite. An interesting fact about sodium nitrite. So because of its, which is in like many of even our own foods that are preserved, because of its high level of toxicity to swine, it's now being developed in Australia to control wild pigs or feral pigs and wild boar. And it causes a type of fatal blood cell effect called methemoglobinemia, reducing the amount of oxygen. The animals feel faint, pass out, and die. You know, in some cases, this is still being used in our pet foods as a preservative, or some of the treats, for instance. You know, avoid foods with artificial flavor enhancers such as phosphoric acid. Obviously, there's no need for artificial flavor, as well as artificial color. You know, the azo dyes, anything that's, I mean, clearly that's not a natural color, right? I mean, how does it get there? It's artificially colored. And, you know, if you're going to make your own dog's biscuit at home, even say you're going to use wheat, for instance, you're going to use flour, it's not going to be green, it's not going to be yellow, it's not going to be red. Then there's concerns about even some of the protein you might feed, such as, you know, fish byproducts. And what's happened is we poison the ocean, high levels of mercury in some of those fish. So fortunately, the higher quality pet foods that are feeding fish are trying to avoid fish with high levels of mercury. And here's, you know, based on that, some of these fish are really high mercury, such as tuna, for instance. Then there's some of the other chemicals, the Teflon chemicals. Anytime you just open a pet food bag and just look at the lining of that bag itself, the inside coating is quite shiny, and often that's got the Teflon chemicals, and it helps to make stuff not stick to it, but some of that can leach out into your dog's food. As well as BPA, you think about that as this plastic toxin, but it's not only in plastic leaching from water bottles, also found in the tins of dog and cat food. Then there's plastic toys. You got your dog playing with these toys. You're like, great. I'm maybe solving some behavioral problem. I'm having fun with my dog. At least this isn't going to harm him. But then you think about he's chewing on that. If it's a plastic or Rubbermaid, you know, some product that's made from a petrochemical, it can reach phthalates because they've added other chemical compounds to that. So the plastic is kind of going to last. It's not going to break down. It's going to still feel stretchy. Might make a fun dog treat. Your dog chews on that, some of those phthalates, the bisphenol, BPA leaches out. And even worse so is that more of those can leach under your dog's tongue. They're called sublingual. That's a higher rate of absorption for some chemicals. Yeah, here is this one slide here. So this one researcher said the amount of BPA and phthalates that we found from the toys would be considered on the high end. And then, oh, sorry, some of this slide didn't quite make it on here. I just added in new today. But where the FDA, and I just recently did a video on this, where the FDA is investigating a potential connection between diet and cases of canine heart disease. So when they put out this warning, you know, they were alerting pet owners, and this came directly from their website. They're alerting pet owners, veterinary professionals about reports about type of heart disease in dogs, canine dilated cardiomyopathy. In dogs eating certain pet foods, the grain-free ones, you know, ones containing peas, lentils, other legumes, or potatoes as the main ingredients. So in the reports, the FDA, so some of these specific cases are dogs that show signs of heart disease. So decreased energy, cough, difficulty breathing, periods of collapse, which is kind of typical for heart disease. But on the actual news release, they only document 8 cases. I mean, it is unusual in terms of not seeing it in a large breed. It's more common it's in these large breed dogs, or extra large breeds, such as Great Danes, such as Newfies, such as Dobies. 4 of the dogs had a deficiency in the amount of a certain type of amino acid called taurine, which our dogs are not supposed to need in their diet. They're supposed to be able to make it from all their own foods. So there's obviously some link with the taurine, but, you know, is it definitely linked to food? I don't think you can say 8 cases out of, you know, 75 million dogs in the US. Can you link that to diet? I don't think so. I don't think that would sort of hold up in the rigorous cases of scientific study. Good on them to investigate stuff, to alert people. I think it needed to be, but I think they need to back that with more science. And sort of my thoughts based on this case is that if you're feeding your dog a good quality food, it happens to be, say, fish and sweet potato, for instance. It's got peas as one of the ingredients. They're doing well, don't change it. What other things should you do, though? You know, taking all those things in consideration, all those risks, all those things to try to feed your dog healthy. If you're going to feed kibble as part of your dog's diet, you want to choose as best as you can quality food, naturally preserved, no artificial colors, flavors, or byproducts. And I still feed my dog some kibble, for sure. I mean, Tula gets that, you know, probably for 60% of her meal. But vary your pet's food. Right now, I just tried her on Instinct, which is a great quality food. She really likes it. But guess what? It had peas as, you know, the second ingredient. Chicken was the first ingredient. But choose from a variety of foods, and I rotate her foods probably, you know, every 2 to 3 months. You know, I did this with my last dogs, Lewis and Jesse, and I'm now doing it with Tula. Mix it up. So I've even tried her. She loves raw food. I can take like a frozen piece of chicken and she'll scarf that down. I'm going to try her with a prepackaged frozen raw. I haven't done that yet. Some home stuff, if we're making a stew, I'm happy to give her some of that stew, for instance. Some canned food too. Like, it's not just the one thing. And just other things, toys and bowls that are BPA free. I mean, your dog doesn't need all that all that plastic. Beware of the secondary toxins. If you're gonna, water bowls, just use stainless steel. A little bit about now how you can choose a quality food, plus some of my top commercial dog foods, at least ones that I'm comfortable recommending. First, just looking at the ingredient list. You grab the pet food, look at the list. The top 5 ingredients usually make up 70% or more of a dry pet food's entire formula. In general, the first ingredient is most important, and all dog foods must list the ingredients in order of weight. In general, my advice is to have an animal-based protein first. But of course, this can change based on the moisture content of the nutrients. Like the food companies can also play around with it. So you need to have a bit of an understanding of how to read a label, for instance. Meat meal versus chicken meal. Meat meal, really poor quality protein. Chicken meal is a pretty good quality protein source. Secondary, if they've added moisture or not. So what happens is that, so they could add, say chicken as the first ingredient, for instance, in some of the foods, because the chicken's got all this moisture, a whole chicken. But then they dehydrate that, turn that into kibble, and it may be that actually corn is the first ingredient, chicken is now actually third, even though you read the label saying, oh, chicken is first. So that's part of it. So my second big advice, first then looking for the first name source of fat. Anything listed before the fat and including it make up the main portion of the food. You gotta look at the label and just read it. A bit about carbs. Some of the ones such as corn, wheat, soy, they've been linked to allergic reactions in many dogs, and they're not as easy to digest. Ingredient source. You want to just support companies with good track records of producing healthy food, companies which have strict quality control, and those that have shown that their food can produce nutritionally sound. Their food is nutritionally sound, producing healthy dogs. So what makes a good pet food? After all that, like, what do you do? It doesn't have to be quite as complicated as many veterinarians would and other pet food companies would make you think. It can just be basic, simple ingredients. Like it's got to be 100% formulated and balanced, and that's super good quality. It's not the case, because I'm sure all of you on the presentation can think of someone who's been like super on it, feeding their dog like this, the high-end, grain-free, quality protein dog food their whole life, going to the vet regularly, giving their dog regular exercise, and their dog still, this what seemingly should be super healthy dog is getting something like cancer, in middle age. Like, there's other things going on here. So try to make it simple, take it back to the basics, and try to, as you may be thinking about doing with your own food, applying that to your dog as well. Things such as real meat, such as chicken, lamb, beef, bison, deer, fish, is the primary ingredient, sources of high quality, highly digestible protein. The carbs, assuming they're going to be in there, they should be whole grains such as brown rice, barley and oats, or sweet potato. I really like sweet potato, for instance, as a carb source. Definitely, they help in maintaining your dog's energy, but they're not necessarily required for dogs. Essential plant nutrients, antioxidants, enzymes, plus some of the natural vitamins, minerals, and fibers. These are found in other things such as vegetables or some of the additional supplements you might add in. You want to make sure that you've got the ideal source or proper balance of the omega-6 fatty acids, the ones that aren't so beneficial, versus the omega-3, the beneficial fatty acids. The ideal ratio is 2-to-1, not the 15-to-1, currently linked to cancer, heart disease, autoimmune disease, and skin disease. Now, here's some of the commercial pet foods I recommend. There should be a much bigger list, and it really varies state to state, province to province where you guys are, because there's regional ones that are really good quality. But in general, if you want to get a bit of a guideline, Artemis, Asmira, Back to Basics, Bravo, Canidae, Carna, Champion Pet Foods, which includes Origin and Acana, Dogswell, Dr. Harvey's Pet Food, First Mate, Flint River Ranch, Halo, Holistic Blend, Honest Kitchen, Life's Abundance, Newman's Own, Nature Pet Products, such as California Natural, Evo, Nature's Logic, Nature's Variety, Pet Curie and Pet Nutrition, including Go Now and Summit, which I've fed, Primal Pet Food, Rudy's Grain Dog Food, Solid Gold, and we even sold that in the clinic years ago. Timberwolf Organics versus Pet Foods, Beyond, Wellness, Weisong, so he used to even sell their supplements, another really good quality food. And even a new one, I was just feeding my dog Little Tula's Instinct. A bit about supplements. Are they really necessary for your dog? So is it necessary, to be in a quality dog supplement? No, in fact, if you feed your dog a varied diet, such as whole foods, vegetables, fish, raw food, yogurt, flax, they may never need a supplement. If you go out of your way, like, I'm gonna mix all these things in. And in reality, maybe that's ideal, like to feed all that stuff, getting all those nutrients from real whole foods. But the problem is most of us don't do that. I mean, it's a combination of it takes time, more dedication. You gotta mix up the right things, not sort of just feed the one thing to make sure you're going to get all those positive benefits of what's in the food. So in my opinion, the right supplement can help prevent many of the more common dog diseases. Commercial food doesn't contain all the nutrients for your dog to thrive. Just think about shopping in a grocery store. Can you get all of your nutrients in a bag? Clearly not, nor can your dog. A little bit about what's in my new supplement, Ultimate Canine Advanced Health Formula, and how it can potentially help your dog. That's actually Lewis a long time ago with a little puppy who came from the shelter. His name was Ben. So my supplement has a complete vitamin mineral blend, a joint support formula, essential fatty acids, immune support formula, key amino acids, probiotics, essential fatty acids, and now curcumin. Some of what's new in my supplement compared to the dog's time original Ultimate Canine formula, some of the new specific things that can give your dog that extra boost. The colostrum is now increased by 400%. The probiotics, in particular lactobacillus, is now increased by nearly 10,000%. The essential fatty acids are now increased by 50%. Plus now I've added in 95% curcumin. And in particular, for tonight's presentation, you can now get 60% off my new supplement, Ultimate Canine Advanced Health Formula, for only $19.97. The regular price, which it was earlier today, is $47 plus shipping, and you're not locked into anything. So you can try it for 60% off. So plus, if you order in the next 12 hours, you also get 2 additional free bonuses. First, a copy of my best-selling book, Veterinary Secrets, plus a copy of my book, Home Diets for Pets. So after the presentation, you can go to thedogsupplement.com/advance/special, and we're going to actually send you a link. We're going to get into some of the diseases. Dog diarrhea, how can you help stop it fast? So the first big thing, just going back to the basic principle, just stop putting any food into your dog for 24 hours. You want to allow the intestines to rest and regenerate. Always allow access to plenty of fresh water. After 24 hours, you're introduced a bland food for the next 24 hours. That's day 2. Plain cooked white rice for dogs, feeding the equivalent number of cups of rice as their normal diet. After a day of the bland food, you can mix half the regular diet, half the bland diet. By the end of day 3, they should be back on their normal diet. And generally, that can actually probably deal with 80% of the dogs that have diarrhea. Just stop putting the food into them. Rest their intestines, slowly something bland. It's going to firm up. Other things you can use to maybe speed it up even more. Kaopectate, it has a newer version that's safer for dog. The specific ingredient is called a type of clay. Attapulgite clay is the active ingredient, which binds toxins, decreasing the fluid in the intestinal tract. The dose for dogs is 0.5 to 1 ml per pound by mouth every 4 to 6 hours. Treatment only needed for 1 to 2 days. There's one homeopathic in particular called Arsenica album, and it's probably one of the first ones I got introduced to, where I had pet owners using it, swearing by it. This thing works. I'm I gotta try it. And sure enough, I suggested it to other clients, and they found they gave their dog a couple doses, and the diarrhea, boom, stopped. So the dose for it is 1 30C capsule per 10 to 20 pounds of body weight every 2 to 4 hours when they've got diarrhea. Probiotics, no question, they're going to help restore the natural bacteria in the intestine, normalizing the intestinal immune system. The one that is most studied is Lactobacillus acidophilus. We're looking at doses of about 100 million CFUs per 10 pounds of body weight daily. And here's a journal reference, specifically about the effects of probiotics intervention in acute canine gastroenteritis. That's, diarrhea, sometimes vomiting from what they've eaten. A controlled clinical study. They found that the specific probiotic that they tested they're saying may reduce the convalescence time in acute self-limiting diarrhea in dogs. In other words, it was like shortening the duration of the diarrhea. Some of the benefits of probiotics is not just that, right? Yes, for GI stuff, vomiting and diarrhea, but also those probiotics are enhancing the immune system. There are studies that suggest taking supplements with lactobacillus or bifidobacterium may improve the immune response. In some cases, they're thinking up to 70% of the immune systems actually can be located, directly impacted by what's going on in the intestinal tract. The probiotics can also lower the risk of pollen allergies. Then there's this whole gut-brain connection, where they can actually measurable changes. So say, for instance, people and our dogs with anxiety or cognitive dysfunction, they have a completely different type of bacteria growing within their intestinal tract. So what's happened is, somebody postulated, what if we supplement with probiotics, change what's going on in there? Will it affect their anxiety? And in some cases, yes, it does. So there's all these other things going on that potentially can benefit your dog just by supplementing with probiotics. So the probiotic now, as I just said earlier, is now increased in Ultimate Canine by 100%. So it's now up to 15 billion CFUs per scoop. And you're going to be really hard pressed to find a similar supplement that's going to have probiotics in those levels. A bit about vaccines. How many are necessary? What's optional? Perennially I get questions about these, and I think more and more dog owners such as yourself are becoming more aware of what's needed, what's not needed, but I'm still getting asked all the time, like, what do I do? The vaccine question. Yes, I think it's sort of general conceded. In the past, far too many vaccines were given far too often. Yet still today, some pet owners you guys are being told, no, you got to come in yearly. Your dog needs X multiple shots year over year. In my opinion, and many other people's, fortunately, that's not the case. And here's a bit of one research that came out of Purdue, the vaccination protocol and on the immune and endocrine systems of beagles. And what they found is that these vaccinated dogs develop significant levels of antibodies. So these are things directed at different parts of their dogs, the dog cells. So different parts of their cell, different parts of the soft tissue, different parts of, say, what's in the tendons. And in other words, you've got these vaccinated dogs beginning to attack themselves, or else becoming allergic to themselves. So speculation, the speculation must be that something in the vaccine is one of the etiologies in dogs that are genetically susceptible of such diseases, such as cardiomyopathy, a type of systemic lupus, or SLE, so systemic lupus, glomerulonephritis, a type of immune complex disease that can cause kidney disease, etc. So it's a real thing. It's not just sort of like an internet, vaccines can cause problems. They can. They really are causing problems. So that's why I think it's really important that you're aware of, what vaccines is your dog being given. Ask those hard questions to your veterinarian. What diseases are they seeing in that area, and what does your dog really need or not. I'm not saying blow off all the vaccines. I get a puppy again, I'll give him the base vaccines, but probably that's it. As I said, ask those questions, right? What's needed, what's not. Hard questions with other people that in your area, along with your veterinarian. My opinion, so puppies only need a series of 2 vaccine boosters, one at 8 weeks, one at 12 weeks. No question, that's the most critical time to prevent infectious disease. We still see rabies, for instance, in the area. We still see rabies, for sure, in a small number. We still see parvovirus as the one sort of big infectious disease amongst our dogs. It can live for a long period of time, survive comfortably at the dog walk, for instance. So that's why I would vaccinate my puppy for parvo. But would I give him the whole other things that can go along with those series of boosters? No, I wouldn't. Delay giving the rabies vaccine until 6 months if it's required. And I'm saying only give parvo distemper, give kennel cough vaccine, that's Bordetella typically. If you're going to a kennel or a puppy class, and you're delaying giving the rabies vaccine until 6 months if it's needed. In many cases, it's required by law. It has to be given some places yearly, some other times every 3 years. At the very least, try to stretch it out to every 3 years. Common sense. Just want to keep your pup safe, avoiding exposure to public areas until they're got a reasonably developed immune system. I don't recommend vaccines for things such as coronavirus, lepto, Lyme disease, canine influenza, giardia, and even cautious use of the Bordetella or the kennel cough vaccine. And then after they've got the boosters at 8 and 12 weeks, if I had a pup, I would give them distemper parvo at 8 weeks, distemper parvo at 12 weeks. I personally, in the area where I live, we have such a low incidence of rabies, it's virtually non-existent. Yeah, there's been an occasional bat. I mean, rabies exists in the bat population. Chances of my little dog Tula being bit by a bat with rabies is about 1 in a zillion, so I'm not worried about that. And then that's all I would give her. And then I would do a titer test at a year. If she's got adequate levels of parvovirus immunity, immunity to sempervirus, then I probably wouldn't give her any further vaccines. And just you learning all about it, right? What's in your area, what's important, asking other dog owners, asking your veterinarian, and just some of the other common sense things, right? You're feeding your dog well, raw food, supplements, exercise, positive human interaction. Oh, now about itchiness and chronic itchy dogs. My dog constantly licks their paws, scratches their skin, has been diagnosed with an allergy. What do you need to know? Here's probably the most common reason I saw dogs coming into the vet clinic next to, like, the annual exam and or whether they're itching. So atopic dermatitis is the most common cause of allergic symptoms in dogs. In the past, this was explained as being due to allergens that were inhaled. Now the belief is that most of these allergens are absorbed in the skin and they cause your dog's immune system to respond inappropriately. So it's externally on the skin, there's a breakdown in the skin barrier, and then the dog reacts and itches. So scratching, hair loss, the smell, recurring ear infections. There can be excessive paw licking, anal licking, redness, especially in the groin. There can be blackening and thickening of the skin. So what's the cause? You get the immune system responding inappropriately to a whole host of things. It could be in what's going on in the house, such as house dust mites, which isn't all of our houses. You can vacuum as much as you want. They're living in cracks and crevices, millions of them. Grasses, could be to vaccines, could be to food such as wheat, corn, etc. And what's happening on a cell level, in some cases, you get a certain type of cell that's releasing inflammatory components such as histine, leukotrienes, resulting in the inflammation and the itching, known in the veterinary world as pruritus. So what you do first, do a proper food trial first, right? And if you've never done it, I always say sequentially do it in steps. So you've got an itching dog in general, sequentially do it in steps is first. Rule out, make sure there's not parasites, or deal with fleas, rule out things like sarcoptic mange, etc. And then, assuming it's not an external parasite, then secondly, do a proper food trial. I always suggest that if it's never been done or it's sort of been half done, where you're feeding a completely different protein with minimal added ingredients. One that I used a lot in practice was fish and sweet potato. I still like that today, right? Because it's a protein that most dogs have never had, or very little have ever had, and a pretty good, healthy sort of carbohydrate replacement source. And it's just simple. I say feed it for exclusively for 12 weeks, minimum 6 weeks. So try to stick for at least a month and a half. Most dogs are going to respond after 6 weeks. You want to add in higher doses of the EFAs, essential fatty acids, flaxseed, flax oil, or fish oil. The big thing is you need higher doses, so therapeutic doses of about 1,000 milligrams per 10 pounds of body weight daily. Some people are pretty adamant it's got to be fish oil or else. Mueller did a study and they compared fish oil, flax oil, found equivalent effectiveness. Personally, I would just start with the flax oil, but make sure you're at a high enough dose. And that's about, if you're going to feed flax oil to do this, you need to feed about a tablespoon per 50 pounds of body weight daily. Bioflavonoids these are the ones that can, they're found in the bright color of the fruits and vegetables. Say, for instance, what gives the apple peel redness, and that would be quercetin. It's one of the ones that's in that. It has been shown to be helpful for people with allergies, may be effective with dogs. The dose is 25 milligrams per 10 pounds of body weight daily. Vitamin C, some people find it as a natural antihistamine. It's worth a try. It's inexpensive, pretty darn safe. You want to start with a slightly lower dose of 50 milligrams twice daily per 10 pounds of body weight. Too high, it can cause diarrhea, but it's worth trying. Conventional antihistamine, Benadryl or diphenhydramine is the one that's most commonly used for our dogs. It's given a dose of 1 milligram per pound of body weight 2 to 3 times a day. Yes, it's first best to consult your vet before you're starting it, especially if you're on other medications. In general, it takes about 14 days of using these to see if they're helping. And it's one where I talk to clients about using as needed, like when there's a big flare up, say early in the spring. Okay, can you try the antihistamine first before we go to something stronger, such as the prednisone? That's also before I knew about some of these natural alternatives, which I never discussed. Licorice root. So this is considered by some holistic veterinarians as kind of the steroid replacement. It's meant to be used short term, not long term. So what you're going to do, you can use the tincture. You're looking at doses. When I say 1 drop per pound, so generally you're looking about a half a mil of the tincture per 20 pounds of body weight twice daily. Somewhere it's just, somewhere between 3 to 5 days. There's a big flare up, try it. I tried it on Tula. She responded. She was licking away in her groin early this sort of spring, like driving everybody crazy. And it really had her sleeping, which was awesome. So it did help. 95% curcumin, you bet. You've got a dog with ongoing allergy, get them on some curcumin. Because it's been shown to help decrease the level of itching and skin inflammation. The dose is about 100 milligrams per 10 pounds of body weight daily. You want to make sure you're ideally giving capsules. It stains everything orange. And you got to be giving it with food, and in particular with some fat in that food, so it also can get absorbed. And then regular bathing. It's one of the most overlooked simple options to decrease the itching in any allergic dog. You're especially wash your dog comes in from being outside, have a damp towel, wipe their feet. Because think maybe your dog's allergic to grass. Just wipe those allergens off. Then regularly shampoo with an oatmeal-based shampoo and conditioner. And in some cases, some dogs respond to daily shampoo. Even just rinsing them off. Don't even necessarily have to shampoo them, but just washing those surface allergens off. Spray them down, dry them up. And then at least you're not allowing that stuff to then penetrate into the skin. Then there's some of the topical therapies. They've been developed with the goal of improving the skin barrier functions. The idea is you topically apply some of these lipids and helps the skin repair these cracks, stopping these allergens, say the pollen or something, from penetrating in the skin in the first place. They're different than supplemental fatty acids. They're applied directly onto the skin. And they're the most important part of the skin barrier. So here's one. I think it's Dermoescent, Essential 6 Spot On. All these, they're available through a veterinarian, some of the pet supply stores now. It contains essential oils and fatty acids. And the instructions for this product, for instance, are to apply 1 pipette a week for 8 weeks and 1 pipette every 2 weeks for maintenance. And there's one study showing positive results with a decreasing level of itchiness. And lastly, this actually was my most recent video, fairly recent. I did it about a week ago. That's Michael's dog, Heather, who's staring away at me. Dog scratching, stop with this. And here it is. So the big thing is that, he went through the course of having these itchy dog talking to me like, why is this dog itching? And they're both the dogs, Heather and Angus, were itching. They're middle-aged dogs. They hadn't any history of any type of allergies. So we're like, okay. I'm like, they were at a kennel, and he probably picked up some type of parasites. First, he tried to naturally treat for fleas. They kept itching. So then he's like, then he picked up one of the topicals from a veterinary clinic, Advantage. They still kept itching. I'm like, well, it's possible that it's lice. It's possible that they picked up a type of mange mite, Sarcoptes. Maybe it's not traditional, but especially I have 2 dogs itching at once. So he picked up Revolution, which works well for treating mange, Sarcoptic mange. That didn't work. So we're like, okay, what else could it be? So maybe food trial. Something went through a whole food trial, fish, sweet potato, still itching after 6 or 8 weeks. So then last, it was like, well, maybe it's maybe they've developed an allergy, maybe to something indoor, such as house dust mites. So we got them on. When we released Ultimate Canine, it was kind of his dogs were in the first trial. He said it took about 3 weeks. So he's like diligent. They're getting a full dose of Ultimate Canine Advanced daily for 3 weeks. And after about 3 weeks, the itching peeled down, because there's a number of things in Ultimate Canine that can help deal with the allergic response. And it's nice to have a real live testimonial knowing, it's working, which is awesome. A stinky dog. So you've got a dog with nasty smell. And this is a pretty nice home remedy I concocted for Lewis's buddy Pearl. So most of the dogs that have this doggy smell, they often have excessive yeast and bacteria. It's often secondary to an allergy. So the first thing ideally you're going to deal with to stop the underlying problem, to go through what we just discussed, dealing with the allergy. But then secondarily, you also sometimes need to treat the yeast. And that's what happens is we're trying to deal with the allergy, but there's this yeast overgrowth. So here's my homemade doggy odor shampoo. And this is what's in it. 3/4 of a cup of water, and actually use green tea. 2 tablespoons of Castile soap. So this is just a natural concentrated soap product. It's based on things such as olive oil. You're going to pick it up at a natural health store. Many pharmacies are going to have it. And just great. You can use it as a basis, say for a clean air, for your own homemade shampoo. And it's so nice to actually have our natural soap base. Then I use 2 tablespoons of apple cider vinegar, which is also effective against yeast, as well as 10 drops of lavender oil. So that essential oil is also effective against yeast. So I just mix. It's kind of funny because you add the vinegar, it turns all funky white color. I mix it up really, really well, pour it all over Pearl, rub it in really well. You gotta leave it on for a full 10 minutes. There she is sitting in the bath. I timed myself 10 minutes and I waited. Then I rinsed it off really well. And I mean, Pearl was like smell free for almost 3 months. And Evie said that was the longest she'd gone, like years. So, and I've had other people try it, say it worked really well. In particular, curcumin, I talk a lot about it. And here's some of the things you need to know. I mean, it's just such an under discussed, potentially really beneficial herb for our dogs. It's received this worldwide attention for its multiple health benefits, which appear to act primarily through its antioxidant, anti-inflammatory mechanisms. And here's another article link and study about it. Disease prevention. It helps with osteoarthritis, skin inflammation, metabolic disease, things such as Cushing's disease, uveitis or inflammatory eye disease, liver disease. They're beneficial for chronic inflammation, such as what can be happening in the brain and cognitive dysfunction. Then overall cancer rates are much lower in countries where curcumin is consumed at the levels of 100 milligrams per day, which makes you think, like, why don't we have more of that in our diet? I think I need to have more of that in my family's diet too. So now, that's, knowing all that, I mean, that's why I added it in. So curcumin is now an Ultimate Canine Advanced at 100 milligrams per scoop, and that's how you can provide that level to your dog daily. Can my dog eat people food all the time, or am I harming her, at least according to my vet? Great question. No one knows what the perfect dog food is. Some foods have too much or too few nutrients. There's certain toxins, etc., other contaminants. Things such as these chicken strips, etc. We got over 600 dogs have died from contaminated jerky treats. We're still not clear exactly on the ultimate cause. Most of them seem to be imported from China. Or over 8,500 dogs were reported to have died during the pet food recall in 2007. There's some of the increasingly common diseases such as cancer, diabetes, allergies, immune-mediated disease, and they're linked to diet. So what we do know is certain ingredients in people food can be healthier than often what's in your dog's kibble, especially if that's all you're feeding your dog. And this is like, even if you're not going to take anything from, say, tonight's presentation, just regularly add some of these. And that's the point, is you guys getting the link, which I think many of you have, but making it more reinforced between food, nutrition, and how that impacts your dog's health. And also how you can use nutrition to treat some of the diseases. This would be preventive as much as anything. Adding table scraps, you're mixing up your dog's food. You're adding additional vegetables and fruit. Darn right, there's all those good, healthy nutrients that are in vegetables. Some of those antioxidants, some of those flavonoids. The healthy omega-3 fatty acids, such as in regularly adding in flax oil. Natural probiotics found in yogurt. Most of the time I have yogurt in my morning, and often Lewis would get some yogurt. Tula not as much because she doesn't really like yogurt. And eggs, such a wonderful complete protein source. Hip dysplasia, cruciate ligament injury, and arthritis. Some of the things, 7 steps that you can do now to have your dog feeling better without drugs. So here's a guy here. It looks like he's got, there's a pin there. Looks like there's a fracture in the end of the femur. The aspirin joint and more. So the first big thing is acupressure. And then I have a little video on it, and this is showing the acupressure point. So we're looking at what's related to acupuncture. You guys are all probably familiar with that. It's a form of Chinese medicine. and you're keying in on certain points, and they're relating to how energy flows throughout your dog. There's a couple points in particular. One is called BL60 Ki3. That's the outside and the inside webbing of the hock joint. And I'll just show you here. I'm just going to see what you guys can see here. I'm just going to move the slide over. I don't know if you can see my foot. I'm not sure there. Okay. No, not quite. Actually, I'm just going to move the camera down. Live video. So all you need to do is see my foot. I think it's there. There it is. So here, you can grab your ankle, right? So there it is. Yeah. This is the Ki3 is the inside, BL60 is the outside. I've got my thumb and forefinger together. So there's this big tendon, there's the Achilles tendon, there's the flap of skin, yeah, between the tibia, and right in there. And you're going to hold, and when you're doing acupressure, you want to do moderate pressure. You want to indent the skin, not that it hurts, but moderate pressure. Hold that for 30 to 60 seconds, and do that twice a day on your dog. And just see, you've got a dog, especially if you've got arthritis in the lower legs, or he's got some hip dysplasia, just any older dog can have it. And it's definitely worth trying. Lewis, I actually did acupressure a fair amount on Lewis as he was getting older, and he seemed to really respond. Tula's not, she's not quite as open to it yet. Another couple points, GB29, GB30. These are 2 points on the back of the hip, and one is depression in front, one is depression behind. And I actually have a video on YouTube which shows you where these specific points are. But once again, you're just going to hold those 30 to 60 seconds twice a day, especially if you've got a dog that has hip dysplasia. Super easy to do, really worth trying. And you never know if your dog's going to respond to it or not. So there they are. There's GB29, GB30. And that's the point of the hip there. And what that means, that's the point of the femur there, this chunk of bone that sticks straight out. A depression in front, depression in behind. So after the presentation, you can just Google Dr. Jones YouTube or Veterinary Secrets YouTube and search for my video, Acupressure for Dog Arthritis. A bit about some of the herbs that can help for arthritis. Curcumin, which we just discussed, 95% curcuminoids. We've got a pile of research showing positive benefits. They must be given with fat or sort of ground black pepper. It's easier to do it with fat with our dogs. Therapeutic doses 100 to 50 milligrams per 10 pounds of body weight daily. Boswellia, the active components, they have strong anti-inflammatory and pain-killing properties. It also may help prevent cartilage loss. Doses of 10 to 20 milligrams per 10 pounds twice daily. So these two in particular work really well together. Curcumin and Boswellia. I was looking at one study where they published a list of natural anti-inflammatory agents, and they showed that curcumin given in combination with Boswellia was as effective as naproxen, which is huge, right? Why don't I use more of it? I don't know. And why people don't, I don't know. But anyway, it's just so good that you guys are aware of it and you can incorporate that with your dog's health. Russ talks, a homeopathic can consider. This is one in particular used for soft tissue injury and, pain or stiffness. And often that goes hand in hand with our dogs that have arthritis. The dose 130 capsule per 10 to 20 pounds of body weight once or twice daily. Frankincense, so that's the name given to Boswellia, which we just discussed, in lemongrass oil. So these are topical essential oils. You're going to take them and you're going to dilute them with olive or coconut oil. Olive oil is easiest. I really like coconut oil. And you're looking about 10 drops of each to 1 or 2 tablespoons of the oil. So that's the carrier oil. Rubbing, so in, say, a small bowl, rubbing it in your hands and applying it topically to the affected areas. I find it works really well if you get, say, along the back, if you've got especially our older active dogs, that can get spondylosis where the spine starts to fuse, say these border collies that jump all the time. They can get LS or lumbar sacral stenosis, big sections of the spine can fuse together. And that can make a real difference if you apply that essential oil on topical or even on the inside of the knee for our dogs that have chronic arthritis from ACL injuries. A bit about CBD oil for pets. Many dogs are responding really well to it that have arthritis. And it's been shown to have potent anti-arthritic and therapeutic action. We're looking at doses about 0.1 to 1 milligram per 10 pounds of body weight twice daily. So the big thing with CBD oil is you guys, one, being aware in it being available in your area. CBD is still considered it's non-psychoactive. So most places you're able to get it. You just want to be careful that if you're going to order it online, that it's from somewhere where they're putting care in terms where it's produced, how it's produced. So you want it to be raised ideally much more naturally than someone using chemical fertilizers, that they're going to use an extraction such as CO2 extraction. They're not using some of these sort of toxic solvents that can leach into the supplement. You're going to have to maybe pay a bit more for it. My point is, don't get the cheapest one. Try to get one that's got some sort of referral behind it. It's got some, ideally, either some veterinarian or some with some authority that's, giving some credibility to the product. Glucosamine, of all the different supplements, I always say get to start with this. The dose is a quarter of a 500 milligram tablet once daily for 10 pounds of body weight. It's helping rebuild the cartilage, delay further cartilage breakdown. Every dog that's got arthritis should be on glucosamine in conjunction with chondroitin and MSM. Chondroitin is another key component of cartilage, and all three of them work really well together. So my supplement, Ultimate Canine Advanced Health Formula, contains glucosamine, chondroitin, and MSM at levels that are considered beneficial for arthritis. A dog with recurring ear infection, what can you do? Another great question, because it's such a big issue. First, you want to clean them. Of all the different cleansers, you can go to your veterinarian and get different types of ear cleaner, but you need to start with the basic. You got to get the stuff out of that ear to start. Acetic acid has been shown, so vinegar has been shown to be very effective at removing debris from the ears, also killing most of the yeast and bacteria responsible for ear infections in our dogs. But if your dog has these red open wounds, don't put any, especially undiluted vinegar on there, because it's super painful. It can really sting. You need to use something soothing, like a cotton ball and just something like olive oil and vitamin E. And if you're going to be using the vinegar, acetic acid, do an 80-20 dilution. Not like even, you want to, because it's still effective 80-20. You can just pick up a syringe from a local pharmacy, put a small amount of the vinegar solution, squirt it into the base of the ear, rub the base of the ear really, really well, wiping out as much debris as possible. So your first is just trying to clean all that crud out. The next thing is you're going to treat the infection. Like, how do you treat it? So most of the dogs that have recurring ear infections, they have yeast ear infections. And yeast respond, and that's that sort of black debris. Like, most pet owners think their dog he's got to have ear mites. Virtually, of all my 20 years of vet practice, I saw maybe 4 dogs with ear mites. Hundreds and hundreds of cats, 3 or 4 dogs. Most dogs have yeast, not ear mites. So that's why they can respond to apple cider vinegar. It's naturally antibacterial, antifungal, and I like it a little bit better. It's not quite as acidic and quite as irritating as just regular vinegar. Is it going to help? I prefer still an 80-20 rinse, the apple cider vinegar and warm water or of green tea. So you might take, just under a cup of green tea, adding in 2 tablespoons of, say, apple cider vinegar. Fill the ear canal up with solution, rub the base of the ear to mix it well, wipe the excess out with a cotton ball. I wrote on here, repeated twice a week, but if you're treating it, you can do that twice a day, ongoing, twice a day for somewhere between 5 to 10 days. Tell your dog, stop shaking. Okay, seems pretty good. And then sort of once a week as needed. It's even preventative. Maybe these need to be once a week. Maybe it only needs to be once every few months. If it keeps coming back. Another option is Burrow solution. It's aluminum acetate. It has antibacterial effects. And so if it's a primary bacterial infection, this is another option. And you can directly apply 5 to 6 drops in both ears, cleaning twice a day. But most of the recurring ear infections are the ear infections period or yeast. Canesten, it's an over-the-counter antifungal medication. Not that chlorotrimazole there. That's in most of the common veterinary medications that are used for dog ear infections. You go see your vet. He says, yeah, you got an ear infection. Go home with this twice a day, somewhere between 5 to 10 days, for instance. More often than not, they've got this as the antifungal. So you can just pick that up. It costs you less than $10. It'll last you for a year, as opposed to $30 or $40 from your vet. That's going to last you 10 days. And you could use that topically, applying it twice daily for 7 to 10 days. Then the last thing is just treating the underlying cause, right? Most of these guys have an allergy, so go through the steps. Do the allergy diet. Feeding it for minimum 6 weeks. Rule out food allergy. If it is, most common allergens in dogs are beef, chicken, egg, milk, wheat, soy, fish, rice, potato, and corn. Of course, that's half the things you might feed. Most dogs, though, in one study, react to just 1 or 2 food items. Ew, poor little pugster. They're cute. Also, look at adding in some of the 95% curcumin. We're trying to take away the inflammation in the ear, decrease the amount. High levels of curcumin stimulate the adrenal gland to secrete cortisone. So, as I talked about that dose, about 50 to 100 milligrams per 10 pounds of body weight daily, because we're trying to take the inflammation down, prevent it from coming back. So this might be a really good way to prevent this thing from coming back again and again and again. Make sure you add in additional omega-3 fatty acids, be it in the form of flaxseed, flax oil, or fish oil. And here are some other important facts about the benefits of the omega-3 fatty acids. And no question, they probably are one of the most important supplements in veterinary medicine, being beneficial for inflammatory skin disease, being beneficial for osteoarthritis, being beneficial for heart disease, for kidney disease, even for cognitive dysfunction. And this comes from a veterinary publication, Clinician Brief. The top 5 therapeutic uses of omega-3 fatty acids. And essential fatty acids, these omega-3 fatty acids are now increased in my new supplement, Ultimate Canine Advanced Health Formula, at 1,500 milligrams per scoop. It's a 50% increase. Cancer in dogs, why is there so much of it? What can you help do to prevent it? First, it's a good question, and I wish I knew all the answers. Unfortunately, no, I don't. I've had it affect more than a few of my animals and so many other people that I know of. So why? Many of our dogs are poorly fed, many have been over-vaccinated, over-medicated with too many conventional drugs, and just think, if you're feeding crappy food, too many vaccines, they're, having to deal with, say, ongoing topical flea and tick medications, clearly that can overtax their immune system. Maybe that might secondary affect different organ systems, having the immune system respond inappropriately. Here's my former colleague in surgery just taking out a big spleen tumor in a dog, hemangiosarcoma. Some rather startling cancer facts. Canine cancer affects 1 out of every 3 dogs. Of those, over half will die of cancer. If you got 80 million dogs in the US, 27 million number of dogs will be diagnosed with cancer. Of those, 14 million are going to die of cancer. That's huge, huge stats. So avoid known carcinogens, avoiding herbicides, pesticides, smoke, artificial color, food that's got artificial color, flavor, the excessive use of vaccines, excessive use of conventional medication. Adding in anti-carcinogens, those found in fresh fruit and vegetables, nutrient-rich protein sources such as salmon. The healing fibers such as ground flax. That's now suggested, that people take ground flaxseed, because there's also anti-carcinogenic benefits in the actual hull of the flax, or the flax seed itself. Say, for instance, with breast cancer. And if it's beneficial to people, likely it's also beneficial to our dogs. Some of the antioxidants they have been shown to slow the growth and spread of some types of cancer, such as vitamin C, vitamin E, and selenium. They're probably most important. The vitamin C dose, 100 milligrams per 10 pounds of body weight daily. Vitamin E dose, 100 IUs per 10 pounds of body weight daily. Curcumin, once again, a phase 1 clinical trial looked at giving curcumin to 25 patients with precancerous changes in different organs. The study seemed to show that curcumin could stop the precancerous changes from becoming cancer. Just huge, right? The essential fatty acids, again, which we're sort of been discussing, flax oil or fish oil. Ideally, you're having your dog on higher doses, but at least regular doses, so it's potentially helping prevent it in the first place. We're trying to think, what else can you add that's going to help decrease the likelihood of your dog getting this? So they're on additional curcumin. They're on additional essential fatty acids, flax oil or fish oil. This is more in particular one that's focused for dogs that already have cancer. This was developed by a veterinarian in Hawaii. It's called ApoCaps, and a number of dog owners report that it was very beneficial. Made in the US, all natural ingredients, and it's available on Amazon. After the presentation, you can just Google apocaps.com and read about it. Dandelion root. So I actually did a video on this, and in particular, it's helping not necessarily just prevent, but also they're actually using it to treat people that had end-stage leukemia. So here in Canada, the University of Windsor, that's in Ontario, they have adjacent to the oh, just hear someone coming up here. So adjacent to the research center, they have a cancer clinic where patients are going in and being treated for cancer. And the story all started with, you've got these people with end-stage type of blood cancers, non-responding to chemotherapy, being told to go home. There's nothing else we can do. This one old lady's like, I'll treat myself with dandelion root tea, which she did. 3 months later, she comes back in. She's cancer-free. She tells someone else with the same type of cancer. And she herself does the same thing, goes through the same, lots of dandelion root tea. She's cancer-free. So they're like, well, there's something here. So they've since investigated it in a much bigger way, isolated specific compounds that are in dandelion root that can be really helpful for not every type of cancer, not every dog. And there's obviously a number of different factors going in there based on what type of cancer, where is it spread to or not, sort of some of how genetically, maybe how you might absorb that too. But that being said, pretty promising to see that, and it's all available to us as well. So if you're interested, you can go to my YouTube channel, search for, dandelion root for cancer, because how you'd be making it at home is you need to actually get the dry dandelion root from a natural health store. You got to grind it in a coffee grinder. You've got to add in, say, a tablespoon of that ground dandelion root with a cup of water, let it simmer for about 15 minutes, and you're going to give that to your dog 15 or 20 minutes. Let it cool down. You're going to give that amount to your dog throughout the day. And they're looking at about 1 teaspoon of the ground root for about 10 pounds of body weight. So you might add a teaspoon into a cup of water, let that simmer down, and give that to your dog throughout the day. And honestly, that's one of the things I gave my dog Lewis. A bit else, and then other things that are going to help boost your dog's immune system in the first place, hopefully preventing things such as cancer. So some of the things that are in my supplement to help support your dog's immune system: bovine colostrum, inositol, aloe vera, mytake, L-lysine, the essential fatty acids, the probiotics, lactobacillus, and bifidobacterium. Colostrum in my supplement is now increased by 400% to 500 milligrams per scoop. Some of the colostrum benefits are helping protect against anti-inflammatory medication side effects. So if your dog's on an NSAID, say they're on Metacam, etc., they should also, in my opinion, they should also be on colostrum. It can help for inflammatory bowel disease. It has many immune supportive benefits that have been documented, not just it can help with weight loss. So people in particular using some of the specific probiotics for that. Lastly, it's also been shown to be beneficial for some people with allergies and may be beneficial with our dogs. So now, once again, with my special going on, 60% off my new supplement, Ultimate Canine Advanced Health Formula, being offered for only $19.97. The regular price, it's $47 plus shipping, and you're not locked into anything. So after the presentation, and as well, too, if you order in the next 12 hours, you can get 2 additional free bonuses. First, a copy of my best-selling book, Veterinary Secrets, along with a copy of my book, Home Diets for Pets. So after the presentation, you can go to thedogsupplement.com/advance/special. The secret remedy in your kitchen. Thanks, you guys. This has been, and you're awesome. A lot of you are still on tonight's presentation. Thanks. It's been over an hour. I hope you find it helpful. A bit about honey. Another really under-talked about, underutilized, hugely beneficial remedy that's so safe. So due to its natural anti-inflammatory effect, honey, for instance, it can help heal wounds much more quickly. It all these different chemicals in it, making it a great substitute for wound dressings. It's now being used in many hospitals. It's naturally antiseptic. Raw honey contains small amounts of a thing called propolis, or the bee glue. And it seals the hive, making it safe from bacteria and other microorganisms. And just think about honey that you keep in your house. it's got all this supposed high sugar concentration to be great for bacteria to grow on. You leave it in your cupboard. Do you ever see anything growing on honey? No, you don't. So, for instance, these researchers, they studied three pretty potent bacteria, MRSA, MSSA, and one called Pseudomonas. They found that the honey works significantly better than any antibiotic against MSSA and MRSA. Honey to heal wounds. So any wound can have honey applied topically to it. Typically, it's going to be for speeding up a closure of an open wound. Say an example would be a dog or a cat abscess. Wounds such as cuts, grazes, scrapes, when covered with honey and a bandage, it's an excellent healer. So, for instance, in hospitals, they're actually using this honey-impregnated gauze for many of these wounds, especially these wounds that have developed bacteria that are resistant to all the other antibiotics. You can just try it as a topical remedy where your dog's been cut. You're going to clean the wound first really well. And ideally, what I suggest is you're going to do this type of hydrotherapy first, getting rid of all the nasty skin and the infection on the surface of the skin. Then after you're going to sort of dry that off, then you're going to apply on the topical honey. And ideally, you're going to do that twice a day, minimum once a day. And if you can, it's an area where your dog is going to lick a lot, you want to do some type of loose bandaging. Natural cough syrup, lemon and honey can soothe any sore throat. New research points towards the natural dark honey being much more effective than any over-the-counter cough suppressant, which is huge, right? And I've had tons of clients use it and say, yeah, it was super beneficial for their dogs. Dog allergies, local honey contains very tiny amounts of pollen. So the thought here is that if your dog has an ADVI, or this environmental allergy, and it's possible that it's to grasses, stuff locally, you could try honey as a form of desensitization. You need just a very small amount. So the idea is that honey contains some of these local pollen. So if that's what your dog has, worth trying. And it's as little as, I put a teaspoon, could be even less, even half a teaspoon per 10 pounds of body weight daily. And you want to do it for up to 2 months, 60 days to test the effectiveness. But it needs to be raw, local honey. So it can't be pasteurized and it needs to be local. Some of the foods that are hazardous to your dog, and these are just sort of good general ones and points to keep in mind and things you may not be aware of. For avocado, in general, it can cause some vomiting, diarrhea, primary GI distress. Chocolate in all forms, the toxic ingredient is theobromine, also contains caffeine. But the theobromine is a cardiac stimulant and diuretic. So the toxic dose is 2 baking squares to a 10-pound dog. So it's not very much. So regular chocolate, say the milk chocolate, doesn't have very little real chocolate, so it's seldom toxic. But if it's a dark chocolate, or say it's the baking chocolate, that's when you need to be concerned. Fatty foods, the primary concern here is severe stomach upset, in some cases pancreatitis. In my experience in vet practice, in almost most cases, pancreatitis was always triggered by high-fat meals such as gravy or bacon. Macadamia nuts. They contain an unknown toxin which can affect the digestive and nervous system and muscles of dogs. It has even led to paralysis. So you just want to completely avoid them. A small number of nuts and even the nut butter can cause this. Obviously, moldy or spoiled foods, really common in my area. Dogs would get into compost. It's got a type of aflatoxin, and they would show signs of vomiting and diarrhea, weakness, muscle and coordination, even like muscle tremors, high elevated body temperature. In some cases, it would secondary affect their liver. Just obviously keeping your dog away from that. In all cases, if you're not going to eat it, don't feed it to your dog. Grapes and raisins. So it's really a hard one because most dogs can take them and it's fine. But in some cases, they found as few as 6 grapes and raisins have caused acute kidney failure in some dogs. The toxic ingredient is not yet known. Just based on that, just avoid feeding your dog any grapes or raisins. Xylitol, which is found in some of this artificial sweetener, often found in sugar-free products such as gum, candy, etc. The signs relate to a sudden drop in blood sugar, causing incoordination, collapse, and seizures. So if it's sugar-free, just read it. Not every sugar-free thing has it, but many of them do have xylitol in it. So just be aware of it. I mean, it's really a new thing, but if you look at poison control, it's one of the big reasons why they're called and why animals are presented to emergency clinics is xylitol poisoning. Especially the seeds of apples, apricots, cherries, peaches, plums, etc., can be the stems. less so the leaves. So they contain a cyanide type compound, mostly the seeds. So it's fine to give your dog apples, it's fine to give them cherries, it's not the pit itself, etc., as well as the stem. Green potatoes, potato peeling, grain-looking potatoes. They're members of the nightshade family of plants. They contain solanine and other toxic compounds. Primarily, they can cause like severe GI, vomiting and diarrhea, loss of appetite, but also like CNS changes, right? Depression, ataxia. If it's green looking, don't feed it to your dogs. Nutmeg, once again, it's another unusual one. So high levels of nutmeg can be toxic and even fatal. The toxic component is unknown. Signs of toxicity include neurologic signs such as tremors, seizures, nervous system abnormalities, and even death. So completely avoiding nutmeg. A bit more about medical marijuana in dogs. I'm getting asked a ton of questions about this. Should I, shouldn't I? Is it helpful or not? What do I think? So CBD, so cannabidiol, it's one of 85 chemical substances known as cannabinoids, which are all found in the cannabis plant. CBD, it's non-psychoactive. THC, it's a psychoactive ingredient that's only found in small amounts or sometimes zero or even no amounts in CBD oil products. Both of them have therapeutic benefits. So what can some of the particular benefits be? So CBD has been shown to have potent anti-arthritic and therapeutic action, resulting in both joint protection and clinical sign improvement. With nausea, CBD along with THC be effective in both preventing and suppressing nausea. So I say these dogs that are sick from other diseases, say from kidney failure. Maybe they're on a chemotherapeutic drug. Maybe they get chronic car sickness. Seizures, which is a huge one. And they're saying up to 30% of people and 30% of dogs don't respond well to the conventional anti-seizure medications. So right now, CSU has been doing a study. Dogs have epilepsy and their response to CBD. Studies are showing there's the big potential of CBD being used as a big therapeutic benefit. The point, though, is you're probably going to need higher doses than we think. We don't know for sure, like what dose you start at or not. They're starting at quite low doses, 0.1 milligram per 10 pounds of body weight, going up as high as, I think, 2 to 3 milligrams per 10 pounds of body weight daily. Then anxiety, once again, right? So say separation anxiety, noise anxiety, and they're a real big potential benefit of using CBD. Then cancer, which I used in my last dog, Lewis. So I think with cancer, first of all, he responded really well to CBD, and they had 90% CBD, 10% THC. The product he used called Phoenix Tears. I might have a picture of it here. There it is there. So within cancer itself, they're finding, so some of the cancers, especially they have, the CBD themselves, it possesses this anti-cancer effect, so it'll stop it from proliferating. It can bind, they can have certain, and some of the cancer, the CBD can bind to it and make it less likely less likely for the cancer to spread. Make it more likely for then the immune system to recognize it and be able to attack it. Because cancer works in lots of different ways. It's not just that cancer cells grow and they spread and you get this big massive tumor. They've figured out ways to avoid the immune system, avoid the detection from the immune system, making it easier for it to spread. And some of the medical marijuana products can play a role in helping either treat and maybe in some cases prevent some of these cancers. Starting doses, typically about 1 milligram of CBD per 10 pounds of body weight twice daily. And as I said with my dog Lewis, I had him 10% THC, and it worked really well. He was on fentanyl, super strong narcotic, wasn't helping his pain. He had mouth cancer. He was on tramadol, another narcotic, didn't really help much. He was on Medicam for even a higher dose than normal Medicam. None of those are super helping a lot. So I'm like 3 or 4 days of this. So I'm like, I went to the dispensary, got a dose. Literally that night, I gave him some of the Phoenix Tears. The next day, he's bouncing around. He's walking up the trail. He's doing so well on it. Unfortunately, it was too late to help him for his cancer because it was a really invasive type of mouth cancer that has spread to the back of his eye. But did a really good job of helping with natural pain control. Sorry, I think I'm going the wrong way. Okay. Raw food. Is it right for your dog? Here's what you need to know to ensure that it is both healthy and safe. And I think you get the gist from this presentation, and I'm pretty much in favor of feeding raw as well. But that's what our dogs lived on, right? Raw food. It's only around 60 or 7 years ago, all of a sudden we start producing kibble, right? What are they eating? Raw food. Some of the health benefits that many people have seen: shining your hair coat, eliminated dog odor, better body muscle to fat ratios, cleaner teeth, decreased itching, normalized energy level, better resistance to infections, improved urinary tract health, decreased arthritic pain, decreased allergy symptoms. Some of the concerns, bacteria, foodborne illness such as Salmonella and E. coli, there's spread of these to people. Other concerns include choking on bones and perforation. In truth, the Salmonella and E. coli, I don't think they're well documented. I've never saw this in vet practice. Your dog's stomach has a pretty highly acidic pH, making it very difficult for these organisms to survive. The short digestive tract of dogs also lowers the risk. Just protecting yourself, wash your hands really well, so you're not getting infected as well. Washing your counters, just using really good hygiene. As well, too, the issue around choking on bones, intestinal obstruction, and perforation. I saw a couple dogs that had this. So my sort of suggestion is you're using a food processor, their bones are getting chopped really, really well, really small prior to feeding. And how do you incorporate raw food? Just simple. Meat, chopped bones, vegetables should be a large part of what you're feeding your dog, along with organ meats once a week. Yes, here's the 4 principal food groups: meat, bones, organ meats, fruit and vegetables. Chicken backs and thighs, they're probably the easiest way. You take them out of the freezer overnight, let them defrost in the fridge, chop them up in the morning in your food processor, and that's it. You might add some vegetables to mix into there, and there's your raw meal. Or some other, maybe you want to add in a particular supplement in case you're feeling other things aren't added in. Ultimate Canine is a really good option. And I've tried that. Lewis, he loved raw food. Give him raw anything, he'd scarf that down. Little Tula, she really likes raw stuff too. I'm gonna try to incorporate more of that in her diet. There's an really easy way to start, and if you yet to do so, I encourage you to try. You can also just consider the prepackaged frozen raw. If you're like, I just want one thing simple, I don't want the raw stuff in your house. All the good quality pet supply stores are going to have some. Bit about natural flea treatment. Why? This is an old stat. 44,000 pet health related incidents from spot on treatments being reported to the EPA. So thousands every year, right? There's millions and millions and millions of doses of the array of different spot on medications, along with some of the newer anti-flea and tick medications. Shampoo, just go back to simple things, right? It's nice to speak of a topical once a month, but if you want to maybe avoid some of the secondary side effects that these may be bringing, it might be a little bit more work, such as regularly shampooing. Just regular pyrethrin-based shampoo is fine, ideally combined with oatmeal. You want to make sure you leave it on for a full 10 minutes. You can safely shampoo twice a week. Then there's some of the natural essential oil-based ones that include things such as cedarwood oil. A cedarwood oil spray, and there's one I've used from Triple Sure Natural Flea and Tick products, or Natural Wonder products, Triple Sure Natural Flea and Tick Spray. And I've got some here in my little office back here. You just want to lightly mist them, any essential oil. It's diluted down to 2%, making sure it's relatively safe. And especially your small dogs, just lightly mist them using a flea comb to spread it through them. Young Living also make a specific insect repellent as well too, that some dog owners have found to be very helpful. Borax, it's a home treatment for flea infestations. You want to put it around the cracks and crevices, because what we're trying to do is break down the flea life cycle. You can deal with 20 fleas, you can't deal with 1,000 fleas. So just don't make it easier for them to multiply within your house. So this can be put in once a week into those where the fleas might hide. Where's your dog, your cat spending most of the time? Where are the fleas likely to be? Treat those areas. Suck them up and just thoroughly vacuum the areas where your pet spends time concentrated on the bedding, carpets, cracks, and crevices. Dehumidify. Flea eggs need 75%. So the less humidity that's in your house makes it much more difficult for flea eggs to multiply and for the flea life cycle to keep going. So what other people are doing. They're trying to like naturally control the fleas. They're using a dehumidifier in their house. Then lastly, diatomaceous earth. I really like this as a natural product, virtually no serious secondary side effects. It's made from the skeletons of microscopic algae. It just looks like a white powder. Kind of looks like a flower. It can be purchased in a whole host of pet supply stores. You just want to make sure it's the kind that's meant to be ingested. It's safe for people. It's called food grade. It can be applied topically to your pet weekly during flea season, and you can also apply it in the cracks and crevices of your house. And I even use it on my lettuce. I've taken it orally. Be one of all the different natural ones I discussed, as well as a natural spray that I can really point you guys toward using. Now a little bit more about my new supplement, Ultimate Canine Advanced Health Formula. So it's got a complete vitamin mineral blend of 25 different nutrients, including antioxidants. Yes, I also have neighbors that have dogs, so I'm really in a dog area. This one study was about the effect of antioxidants in the canine model of human aging. In this one study of aging beagles, a diet rich in antioxidants improved cognition, maintained cognition, and reduced oxidative damage and pathology in treated animals. Why you should have more antioxidants in your dog's diet. My supplement also includes the joint support blend. So therapeutic levels of 3 key nutrients, glucosamine, chondroitin, and MSM. And this came from JAMA, compelling evidence that glucosamine sulfate and chondroitin sulfate may interfere with the progression of osteoarthritis. I've also increased a 50% increase in my the omega-3 fatty acids in my key amino acid blend. So the flaxseed oil is now increased to 1,500 milligrams, as well as it's got key amino acids, L-lysine, which is antiviral, for instance, L-methionine, L-arginine. This comes from Muller, which has showed the effect of omega-3 fatty acids on canine atopic dermatitis. So that's the dog allergies, the one that we discussed, so the environmental allergy throughout the presentation. They showed that the dog's clinical scores improved in those supplemented with flax oil in the commercial preparation. In other words, that flax oil was effective in helping dogs that had this environmental allergy or atopy. And that's what's in my supplement. The prebiotics and probiotics now may increase by nearly 10,000%. We've got 50 million CFUs of Lactobacillus acidophilus. And here's another article was published about pet therapy. Would your anxious dog benefit from probiotics? So research into whether specific probiotics can affect our mood and the mechanisms behind the effects is booming in human and veterinary medicine. So far, the results show that the flora present in the guts of human and animals is indeed correlated with a variety of positive and negative emotional traits, including calmness, anxiety, and depression. Dermites, you're dealing with, say, things like noise anxiety, separation anxiety, get more probiotics into your dog. And as I said, I just told you that, and I'm going the reverse way. As well, too, I've got a key immunoprotective blend. It's increased by 400%. So I've added 500 milligrams of bovine colostrum, as well as having inositol aloe vera in my take. Some of the other benefits of the colostrum. It's used as a nutrient, and this comes from the Canadian Vet Journal. Colostrum. It's been used as a nutraceutical treatment for animals of all ages to increase resistance to infection and disease caused by a wide range of pathogens, including bacteria, viruses, parasites, and fungi. It's also used for applications such as healing of intestinal lesions and increasing the absorption of nutrients from the GI tract. So it really, really can be beneficial. I've got those high levels down on my supplement. And then my new ingredient, so it's 95% curcumin, which is at 500 milligrams. Most studies to date have been performed in animals, but given the centuries of use of curcumin as well, it's now demonstrated activity in these are different inflammatory pathways. It may be considered as a viable natural alternative to non-steroidal agents for the treatment of inflammation. And this comes from this review study on natural anti-inflammatory agents for pain relief, which is huge. That's the one. I'm excited by all the different things in combination, but especially having the 95% curcumin in the supplement and how it works in conjunction with some of the other parts of what is in my supplement. Is it safe? There's extensive third-party testing in a GMP facility with human-grade ingredients. All the supplement is tested to ensure that what is on the bottle is in what is on the label is in the bottle, and it's free of any toxins. There's no wheat. It's natural. There's no wheat, no soy, no dairy, no sugar, no artificial ingredients, no additives or fillers. All the ingredients are derived from natural sources, and it's naturally preserved with vitamin E. Does it work? This is best answered by the over 10,000 dog owners who've used Ultimate Canine Health Formula. What Sue said. She's running around and jumping. I raised Yorkshire Terriers. One female was 12 and starting to show signs of arthritis in her back legs. She's been taking her supplement for about a year now and is doing great. She's running around and jumping and all things she used to do when she was younger. I now give it to all my Yorkies. They love it. Thanks for creating it. Thanks, Sue. They love the flavor. I'm giving my 7-year-old Chihuahua and my 6-year-old Yorkie Ultimate Canine for several months. They love the flavor. I know that this formula is giving them what their bodies need to stay healthy and live longer. Thanks, Francis. I feel that these supplements have extended the lives of my dogs. I have 3 German Shepherds that have been using Ultimate Canine for 3 years. I feel that these supplements have extended the lives of my dogs by keeping them healthy and away from the vet. Thanks, Catherine. I get compliments all the time about how shiny and soft their coats are. I have 2 dogs. One's a terrier mix I adopted 2 years ago, and I saw that her coat was real dull and flaky and dry. I started on the supplement, and within 6 weeks, I started to notice it was making her coat shine and feel really soft. My other dog is a Shepherd mix. I get compliments all the time about how shiny and soft their coats are. So I know that because I give Dr. Jones a supplement every day to my pets, that's a reason for such good-looking coats. I'd recommend it to all pet owners. Karin from Wisconsin. Thanks, Karin. Helped her live 3 years after the diagnosis of cancer. The absolute best thing to help your pet be as healthy as they can be. I've had my dog on Dr. Jones's Ultimate Canine Supplement for close to 3 years. Her arthritis cleared up overnight when I began dispensing the supplement. She's fought bladder cancer without surgery. And while other holistic treatments have been used for the cancer, Dr. Jones's supplement has no doubt played a large part of her overall health. Thanks, Dr. Jones. Thanks, Judith. Well, thank you guys for taking the time to watch today's webinar. And a big thanks for, holy cow, 106 of you who have watched the whole thing. That's awesome. That's a long time. So we're coming up right to 6:30. I have enjoyed the presentation. I hope you guys enjoyed giving it. Hope I didn't scare you with my flash of my ankle. A little bit more about what my special is about. So it's 6% off my new supplement, Ultimate Canine Advanced Health Formula. Being now offered for only $19.97, the regular price. It's going to be $47 plus shipping, and plus you're not locked into anything. You're not onto any ongoing commitment. Plus, if you order in the next 12 hours, you can get 2 additional free bonuses. First, you're going to get a digital copy of my best-selling book, Veterinary Secrets, and it sells right now for almost $30 on Amazon, along with a copy of my book, Home Diets for Pets. So now that we're done, yay, you can go to thedogsupplement.com/advanced/special. Ooh, and we're at the very end. So thanks, you guys. We're now at the very end. It's awesome. So I see it went a bit longer than I was imagining. It seems like I seem to stretch out. I try to make the presentation shorter. And I got to include that. And I suspect many of you guys are going to have questions. So what I'm going to do once again, first, thanks for being on the presentation. It's awesome. Secondly, what I'm going to do, I'm going to type in my email. If you guys have questions either about the webinar or about anything relating to the supplement or how that may interact with your dog, by all means, fire me off a question. So my email, it's Dr. Andrew at thedogsupplement.com. So I think Dr. Andrew, there it is. There's my email, drandrew@thedogsupplement.com. So then just feel free to fire me off an email, and that's the best way for me to get back to you. And for all of you being on the presentation, I'll make a point of getting on those. So awesome. First of all, thanks, you guys. I hope you found it helpful. You're going to get a copy of the presentation as well as you're going to get a copy of the slides. So you can refer back to all that. And as I said, any questions, fire me up an email. All right. Thanks for being here. It's Dr. Jones. I'm going to sign out and eat some supper.